Hello everyone, today we are going to discuss a very important topic of head and neck region, that is the tongue. So what are the important points in relation to the tongue we must have to remember? So first thing what you must have to remember, the tongue, it is a mass of a striated muscle. So tongue, it is a mass of a striated muscles which is covered with the mucous membrane. Which is covered with the mucous membrane. Okay. So it is a mass of a striated muscle which is covered with the mucous membrane. Second thing what you must have to remember, the tongue is divided into right and left half by this structure. This is known as median fibrous septum. Median fibrous septum. So tongue is divided into right and left halves by a median fibrous septum. Okay. Now see here, the this is the upper surface or the dorsal surface of the tongue, as you can see in the diagram. So this upper surface and dorsal surface of the tongue can be divided into two parts. The anterior part, this one. So the anterior 2/3 part and this posterior 1/3 part. Okay, anterior 2/3 part of the tongue, this is known as the oral part of the tongue. Posterior 1/3 part of the tongue, it is known as the pharyngeal part of the tongue. Pharyngeal part of the tongue. Okay, and this anterior this dorsal surface, it is divided into anterior 2/3 and posterior 1/3 of the tongue by this V-shaped structure, which I am highlighting here at the moment in the red color. Okay, this one. So this is known as what? This is known as sulcus terminalis. Okay, this is known as what? Sulcus terminalis. Okay, so once again I will show you, this is your sulcus terminalis. Okay, so please remember, the mucous membrane of the dorsal surface or the upper surface of the tongue can be divided into anterior part of the tongue and posterior part of the tongue. The anterior 2/3 part of the tongue, it is known as oral part of the tongue, and posterior 1/3 part of the tongue, it is known as the pharyngeal part of the tongue. And this structure which is dividing the tongue into anterior and posterior parts, this is known as sulcus terminalis. This is known as what? Sulcus terminalis. Now very important thing, that at the apex of the sulcus here, at the apex of the sulcus here, please remember, a small pit is present. This small pit which is present at the apex of the sulcus, which is projecting backward, that is known as foramen cecum. Foramen cecum. Very, very important. This foramen cecum, it is the embryological remnant and marks the site of the upper end of the thyroglossal duct. Thyroglossal duct. So this is the very important embryological remnant, and it marks the site of the upper end of the thyroglossal duct. Okay, so this is the anterior 2/3 part, which is known as the oral part, and posterior 1/3 part, which is known as the pharyngeal part. Okay, now in the anterior 1/3 part or oral part of the tongue, please remember, you have various papilla present. Okay, which these papillas are your which papilla? They are your fungiform papilla, they are your filiform papilla, they are your circumvallate papilla, and then they are your foliate papilla. Please remember, these papillas are absent in the pharyngeal part. So they are absent in the pharyngeal part, they are only present in the oral part. Okay, so the mucous membrane covering the posterior 1/3 part or the pharyngeal part, please remember, it is not containing the papilla. It is not containing the papilla. Please remember, in the pharyngeal part you have only present what? lymph nodules. Okay, in the pharyngeal part, or the posterior 1/3 part of the tongue, please remember it is having no or absent papilla, but there are present of underlying lymph nodules, and they are known as lingual tonsils. They are known as what? Lingual tonsils. Okay. Now coming back to these papillas. Now see here, circumvallate papilla. These are your circumvallate papillas, which I am showing in the green color, which are in close relation to your sulcus terminalis. So in front of the sulcus terminalis, you have these circumvallate papillas. Okay. Now please remember, foliate papillas, they are mostly present in children. They are mostly present in children. Okay. The papilla which are large in numbers, that is, or very, you can say, most populous or large in number, mostly large in numbers, that is your filiform papilla. Please remember, these filiform papillas, they don't have taste buds. They don't have taste buds. Okay, fungiform papilla, they do have taste buds. They do have taste buds. Okay, they do have taste buds. So I show you one more diagram. See here, all the students. So see here, this is the lingual, this is your pharyngeal part of the tongue, and it consists of your what? It consists of your lingual tonsils. Lingual tonsils. These are your, which are 10 to 12 in number. These are your circumvallate papilla. Circumvallate papilla. Okay, fungiform papilla do have taste buds, but the papilla which are larger in number on the tongue, they are your which one? They are your filiform papillas. They are your which one? Filiform papillas. Okay. So these are the important points in relation to the papillas. Now coming back into the muscles of the tongue. So muscles of the tongue are very important. So please remember, muscles of the tongue are divided into the intrinsic muscles and the extrinsic muscles of the tongue. Now see here, intrinsic muscle of the tongues are, उसके नाम से ही पता चल रहा है, they are confined to the tongue. To the tongue, and they are not attached to the bone. Okay. Intrinsic muscle of the tongue, they are confined to the tongue, and they are not attached to any bones. So what are the intrinsic muscle? They are 4 in number. So what are they? 4 in number. Superior longitudinal muscle, inferior longitudinal muscle, vertical muscle, and the transverse muscle. Okay, see the diagram. See here, superior longitudinal muscle, vertical muscle, transverse muscle, and inferior. It will be present on this side also and on this side also. Okay, so what are the functions of these intrinsic muscles of the tongue? Please remember, they will alter the shape of the tongue. This is their main function, shape of the tongue. Okay, so if anyone is going to ask you what is the function of the intrinsic muscle of the tongue, so you can say that intrinsic muscles will help you in the shape changes. Okay, this is the function of the intrinsic muscle of the tongue. Now coming into the extrinsic muscles of the tongue. Now see this extrinsic muscle. Number 1, genioglossus muscle. Number 2, hypoglossal muscle. Number 3, styloglossus muscle. And number 4 is your which one? Number 4 is your palatoglossus muscle. So 4 muscle intrinsic, 4 muscle extrinsic muscle. Genioglossus, hypoglossus, styloglossus and palatoglossus. Please remember, आपको इनके नाम से ही, by remembering the name you can understand. Genioglossus, it is originating from the mandible bone, and inserting into the muscles of the tongue. Hyoglossus, hyoid bone. This is the hyoid bone. So hyoid bone, this bone is the hyoid bone. Now the muscle fibers which are coming out from the hyoid bone and now merging into the muscles of the tongue, that is your hyoglossus muscle. Styloglossus muscle, muscle fibers originating from the styloid process and now bending into the muscles of the tongue, that is your styloglossus muscle. Palatoglossus, from the palatine aponeurosis. Please remember one very important point, that palatoglossus is not truly the muscle of the tongue. Remember this point. It is not truly the muscle of the tongue. Okay. So these are the muscles of the tongue. Now one very important point which you must have to remember, the actions of these muscles of the tongue. Please remember genioglossus on both sides. Right side also, left side also. So when it is acting together on both sides, it help you in protrusion of the tongue. जब जुबान बाहर निकालनी होती, protrusion of the tongue, it is done by your which muscle? Answer is your genioglossus muscle. Which muscle? Genioglossus muscle. And please remember one very important point in relation to the genioglossus muscle. It is also known as the safety muscle of the tongue. This is your MCQ. It prevents the tongue to fall back and close your airway. Okay, so this is the safety muscle of the tongue. It helps you in protrusion of the tongue. Okay, retraction of the tongue. Retraction of the tongue, it is done by these two muscles, styloglossus and hyoglossus muscle. Okay, hyoglossus also perform depression of the tongue also. Okay, depression of the tongue is also done by the hyoglossus muscle. Okay, now one more thing, retraction and elevation of the posterior 1/3 of the tongue, it is done by styloglossus, retraction and elevation of posterior 1/3 of the tongue. Okay, it is done both by your styloglossus and your palatoglossus muscle. Okay, so these are some of the important points in relation to the muscles of the tongue. Once again I am repeating, intrinsic muscle of the tongue confined to the tongue only. Okay, extrinsic muscle of the tongue, please remember, they are the muscles which are attached to the bones. For example, the palate bone, mandible bone, hyoid bone, styloid process. Oh, okay, so now they are attached to the bones, that's why it is the extrinsic muscles. Okay, intrinsic muscles are your genioglossus, hyoglossus, styloglossus and palatoglossus. The largest muscle of the tongue, it is the genioglossus. The safety muscle of the tongue is also your genioglossus muscle. Okay, so genioglossus muscle, it helps you in the protrusion of the tongue. So this is also your safety muscle of the tongue. So it prevents the tongue to fall, to close the airway of the tongue. It prevents or help you in prevention to fall back of the tongue. Okay. So these are the muscles of the tongue which you must have to remember. Now coming into the innervation of the tongue. Now innervation of the tongue is very, very important. Number one, motor innervation. So please remember all the muscles of the tongue. All the muscles of the tongue. Whether they are intrinsic muscle, whether they are extrinsic muscle, all the muscles of the tongue, intrinsic and extrinsic, are innervated by hypoglossal nerve. Except one muscle. So this is your MCQ. Except was. So what is that muscle? That is the palatoglossus muscle. Hypoglossal is your 12th cranial nerve. Palatoglossus, please remember, it is innervated by your 10th cranial nerve. So 10th cranial nerve, it is innervated your which muscle? The palatoglossus muscle. Okay. Now coming into the sensory innervation of the tongue. Now sensory innervation of the tongue, please remember, it is a little tricky because you have special sensation like you have special sensations like taste, and you have general sensations like pain also. So how you can remember it? So it is very easy. We will make one diagram. So for example, if this is the tongue, for example, this is your sulcus terminalis, this is the anterior 2/3 part of the tongue, this is the posterior 1/3 part of the tongue, and it is the most posterior part of the tongue. Okay, posterior part of the tongue. Now when you divide the tongue into these parts, now see here, now what you have to know that now I will divide this tongue into two portions now. Okay, first of all we must have to know the pain sensation. Pain sensation is your which sensation? It is your general sensation. So pain sensation in the anterior 2/3 part of the tongue, it is taken by your fifth cranial nerve. Fifth cranial nerve. Then it is your ninth, then it is your 10th. Special sensation. Special sensation is your which one? Taste. So taste special sensation, it is taken by your seventh cranial nerve. Posterior 9, posterior 10. तो आपने ऐसे याद रखना है 5, 7, 9, 9, 10, 10. Posterior and most posterior, it is not difficult. Both ninth, it is your glossopharyngeal nerve. Both special and general sensation, it is taken by the ninth cranial nerve. Most posterior part, it is taken again by your vagus nerve, 10th cranial nerve. But when you coming into the anterior part, please remember the anterior part is taken by your general sensation of pain. It is taken by your fifth cranial nerve. Okay, fifth cranial nerve is your which nerve? It is your trigeminal nerve. Okay, trigeminal nerve. Okay, seventh is your which nerve? It is your facial nerve. Fifth nerve, it is your trigeminal nerve. Seventh nerve, it is your facial nerve. Now seventh nerve, which branch? Answer is chorda tympani. Chorda tympani. Trigeminal, which branch? Fifth cranial nerve. Third branch, that is the mandibular nerve. And from the mandibular nerve, you must have to know it is the lingual nerve. Okay, so this is how you must have to remember. This nerve sensation is very important. Okay, so mandibular nerve. Okay, chorda tympani, which is the branch of the facial nerve, and mandibular nerve, which is the branch of the trigeminal nerve. So you have to remember all these sensations. Okay, now coming into the clinical correlation of the tongue. Now hypoglossal nerve, it is your 12th cranial nerve. So hypoglossal nerve, please remember, it is, now see this root, it is coming out from the medulla oblongata. Medulla oblongata. Okay, this is the medulla oblongata, this is the pons, this is your midbrain, this is the brain stem. Brain stem is divided into three parts: medulla oblongata, pons, and midbrain. And now the nerve fibers of the 12th cranial nerve, it is passing through this canal which is present in the posterior cranial fossa. This is your hypoglossal canal. Okay, and now it is innervating the intrinsic and extrinsic muscles of the tongue. Now what happened, please remember, whenever there is any lesion of the hypoglossal nerve, please remember there will be damage. It will be deviated to the same side of the lesion. Okay, same side of the lesion. So you will ask the patient for protrusion of the tongue. So when you ask the patient for protrusion of the tongue, so to check the hypoglossal nerve, you are checking the genioglossus muscle. Okay, genioglossus muscle. So when you ask the patient, so now see here what is happening now in the patient. So when you ask the patient to protrude the tongue, for example, in this case, it is protruding to the left side of the tongue. So the left side of the intrinsic muscle of the tongue, as you can see in the diagram, they are atrophied. They are atrophied, and there is a wrinkling, and they are wrinkled. Okay, so there is a weakening and atrophied muscles of the side, and now it is pointing towards the side of the lesion. It's pointing towards the side of the lesion. So when you ask the patient to protrude the tongue, the tip of the tongue, see, this is the tip of the tongue, it will be protrudes towards the side of the lesion. So if it is protruding toward the left side, it means the left hypoglossal nerve is damaged. If it is protruding to the right side, it means the right side of the hypoglossal nerve is damaged. See this diagram which I have taken from the Snell's clinical anatomy. Now see here, right hypoglossal nerve on the right side, left hypoglossal nerve on the left side. Okay, now you ask the patient to protrude the tongue. Okay, protrusion. Now it is in the medial center, it means right and left hypoglossal nerve both are working properly. Now due to some reason the right hypoglossal nerve is damaged. So when the right hypoglossal nerve is damaged, the right side of the tongue becomes atrophied and wrinkled. And when you ask the patient to protrude the tongue, it will be deviated to the side of the lesion. Deviated to the side of the lesion. Okay, clear to everyone? Because left side is intact, it is normal. So it is deviating to the right side. Right side is atrophied, right side is wrinkled. So it means the patient right sided hypoglossal nerve is damaged. Genioglossus muscle. Okay, this is also known as the safety muscle of the tongue. Clear to everyone? One last thing which you must have to remember in relation to the tongue. Okay, that is the uh, lymphatic drainage. Blood supply, it is the lingual artery, which is a branch of the facial artery, and it is also given the ascending pharyngeal artery is also giving blood supply to the tongue. Okay, veins, again the lingual vein which is draining the blood into the your internal jugular vein. Lymphatic drainage is important because see here, the tip of the tongue, lymphatic drainage are draining into your submental lymph nodes, anterior two-third, it is draining into the submandibular lymph nodes, and posterior one-third, it is draining into your deep cervical lymph nodes. Okay, so these are the important points of the tongue, muscles of the tongue, its clinical relation, hypoglossal nerve. Okay, everything. So I hope it is clear to all of you.